post-movement webinar, co-hosted by IPAPF and Intersex Asia. As the first openly intersex person in Taiwan, and for many years the only intersex activist from Asia in the International Intersex Forum, I can attest that our movement here began from scratch. Being intersex is often a solitary journey. Many intersex individuals are unaware of their own intersex identity, have never encountered the term intersex, and don't realize there are others like them. Connecting with other intersex people often only happens with the emergence of intersex activists and the broader intersex movement. We have spent significant time on self-recognition, discovering others, struggling to embrace and accept ourselves, and finally united to advocate for our human rights. What's going on? Okay, I was 42 when I realized I was intersex. Why I was relieved to know I was not alone. I also understood that my experience of gender normalization surgery without consent was not an isolated incident. For too long, binary gender society has tried to eliminate and conceal intersex existence. And as you see, it continues today. But the truth is, intersex exists. I exist. We must unite to raise intersex visibility, awareness, and defend our human rights, not just as intersex people, but as all human beings. The global intersex movement is only 3 decades old. Many intersex people are still on their journey of self-understanding, and the general public largely remains unaware of intersex existence, let alone our struggles and challenges. Being intersex may be different, but we are your families. We deserve to be ourselves and have our human rights respected. This is precisely what I initiated this collaboration and choose to speak with you today. And I think, okay, now is the time that I can share my screen, right? Give me a minute. Why you always come from the...
If there is any technical difficulties, then we can ask Madhurima or Purnima to share the screen. Is that okay?
Can you see my screen now?
No, cannot.
Cannot?
I can see your face, but not the slide presentation.
Oh, what's going on? How about now? Okay.
Yes, very well. Yeah, thank
you. Okay. So where is intersex people? Intersex people are between male and female, and between you and me. We are here. We are between you. We are surrounding you. This is the sign designed by an American intersex persons for raising intersex visibility. And maybe you also heard about that gender is a spectrum. But actually, biologically, human beings are also, a spectrum, which means intersex. And what does it mean exactly? Let me explain to you. My resource is from the UN Intersex Fact Sheet. This is the basic document that can be the educational material for everyone. Intersex people are born with sex characteristics that don't fit typical definition of male and female bodies. Sex characteristics include chromosome, gonads, sex chromosome, and genitals. This is the variation of intersex of people, human beings with genital, internal, and external. But since 1950s, the doctor said only this is normal, and this is normal. In between 1, 2, 3, 4, 5, it is kind of variation, but these are not accepted, and they were called ambiguous genitals. Genital is always the first trait that we identify a person's sex, right? Okay, you may not know there is a standard for our genitals glands according to doctors. Actually, this is from the gender norm, right? What does it plural means? Actually, it means that clitoris that are longer than 0.9, it means too long, must be fixed. Penis that are shorter than 2.5 cm, also too short, must be fixed. And to be what? To be a girl. Can you imagine that? This is what intersex baby is facing. And this kind of normalization surgery without consent on intersex baby is the biggest issue that we are facing. It's called intersex genital mutilations. Until now, this is all still the key issue and the main issue that we are fighting for our bodily autonomy. Who can decide we identify as only us, right? And then we discover there are gonads that can be used to identify a person's sex. Men have two testicles, women has two ovaries, but no longer later we discover there are people have both gonads. So even gonads, there are variation. Then later, we have more ability to discover sex chromosome to identify one's person's sex, but only this one and this one, XY and XX, 13, 40, 46 XX and 46 XY are considered normal. For those in between, all kinds of variation are considered abnormal. But this is the truth of spectrum, even in show in the chromosome variation. So we want to say we exist. Sorry, we are not disorder. Please not take away your hand and to fix our genital. This is our voice, please. And what exactly intersex is? Intersex is an umbrella term used to describe a wide range of natural bodily variation. This is the key. We are natural bodily variation, some of which may be apparent before or at birth, while others are not apparent until puberty or later, or may not be physically apparent at all. Intersex traits are natural body variation. In fact, most intersex babies don't need any medical intervention. And many intersex adults report living happy, healthy lives without undergoing any procedure in childhood. Because their bodies are seen as different, intersex people are at risk of human rights violation, including violence, stigmatization, and harmful practices. Activists around the world are working to ensure intersex people are free from discrimination and have the right to make a decision about our own bodies. So now you may understand more. Intersex means more biologically, not gender identity, and not sexual orientation. You see, from this gender bread person, you can roughly see what it means. But always, there are some misconceptions about intersex people. Intersex people have two sex opposite organs. No, it's not like that. As you see, we are many different kind of variation in between male and female. And intersex is a gender identity. No, because intersex is a biological things. It's not gender identity. But at the same time, intersex people have their own gender identity. They can identify as man, woman, or non-binary, or even transgender. So intersex is the same as Hydra. Actually, is not totally correct. There are intersex people in the Hydra group. Hydra is, I think, is a South Asia specific culture related with transgender. But traditionally, intersex people may be abandoned or sent to join the Hydra group because of the discrimination. But it doesn't mean intersex people is the same as Hydra. I hope that Sylvie can correct me if I'm wrong later. Uh, and intersex people must identify as gender. No, this is not true. And non-binary or queer. No, most intersex people actually identify as men and women. Some of them identify as trans, some of them as identify as non-binary or queer. Yeah. And the last one, intersex is a bad woman shame over family. This is totally not true. Yeah, definitely. Yeah. Okay. Then how common is being intersex? Maybe you filled out. There is a data like here. According to the expert, between 0.5 and 1.7 of the population is born with intersex traits. To better grasp the upper estimate that is higher than the population of Japan. And how what? Oh, in Japan, the population is 125.7 million. So it means that at least we have that much intersex people in the world. And how many of them are in Asia? because Asia population occupy almost 60% of the world, so at least there are 74.2 million. So actually, we are not rare, and we do exist. Last year, actually, there's a new book published in Brazil. It was a research by three intersex person. They say the research identify there are 150 variation of intersex. And the book also estimate that up to 11% of the world population is intersex, which means it's much, much more than we imagine. Yeah, according to this research. It's in Portuguese, so I couldn't understand it totally. Yeah, yeah. But if you understand, you can, look at it. So the challenge that we face, including discrimination and violence, while including like intersex fetus abortion, gender norm, yeah, like what you just heard, that we were forced to uh, choose to choose our sex, without consent, right? And the female athlete, intersex athlete, always face a doubt about their sex and their qualification to participate again. And also, there is intersex infanticide happening in Asia still. Violated physical integrity. Yeah, the normalization surgery actually is a irreversible procedure that can cause permanent infertility, pain, incontinence, loss of sexual sensation, and lifelong mental suffering, including depression, post-traumatic stress disorder, and suicidal thoughts. And we also lack of access to adequate health care, including medication access, proper mental health care, and so on. And the biggest one may be the lack of legal recognition, because you can see there's no intersex register in the civil registration. We don't have this right yet. So action okay, sorry. Action promotion legal legalization should promote universally available sex gender markers that respect the diversity of intersex people, including intersex women, men, and non-binary. Okay. Then I will go to intersex movement in Asia. Actually, intersex movement, global intersex movement started in 1990s in US. The picture you saw now is the first protest by intersex people in Boston, in the United States. People stand out, want to tell, the doctors that we don't want the surgery. Actually, this movement, this action originally was trying to, give suggestion to doctors about the treatment to intersex people, because after 40 years, intersex people who had surgery without consent, they grow up and they gradually discover what they have been through has not been get their consent. So, and many of them suffer a lot. So they want to talk to doctor. Please don't do surgery without our consent. Please wait for intersex people to grow up to make their own decision. But unfortunately, the medical conference, the doctor in the medical conference refused to let them in. So it becomes a protest. So it becomes the first protest of intersex people. And this day, October 26th, has been marked as the Intersex Awareness Day now globally. In Asia, at the same time, yeah, then you see this 1995. This this is the first intersex activist in Japan. They also started the intersex movement in Japan, and Mr. Hashimoto, Mr. Hashimoto started the first intersex support group in Japan called PFSFIS. So even in Asia, our movement started 30 years ago, but the movement in Japan was limited in Japan only. Did not go to other Asia country. And you can see 1997 this poster of the Pride, because it's Pride Month, right? It's Pride Month, June, right? So this is the Pride in Japan in 1997, Sapporo City.
I'm
And you
sorry,
can
Heike. Sorry to
yeah.
jump in. It's very good presentation, but I think you should wrap up. Thank
Oh,
you.
okay.
Yeah.
Wow, rapper, I just started.
So anyway, we
Okay.
are going to share this presentation to everybody. They can look into, of course, they can come back to us for any questions. Yeah, Heike.
Uh, okay. I just want to say that intersex already, start to show up in Asia. Yeah. And the first book for by intersex people for intersex people was also published in 1998 in Japan. So for our movement, before Intersex Asia built, it's all by individual activists by before, because Intersex Asia was started in 2018. So before, without this intersex activists come out, we cannot make a movement. So before 2018, it's a it's a movement building by individual only. So in 2008, I started OI Chinese, the first intersex-led organization for Chinese-speaking people. And I initiated the Free Heart with Intersex movement campaign, in Taiwan. And that's why I was, identified as the activist from Asia to join the International Intersex Forum. So being the first and the second, the only intersex representative from Asia, I really need to find reach out to intersex people in Asia to create our movement. So I started to reach out and to find, intersex activists in Asia, and I discovered one by one for them. Then in 2015, we gathered together in Taiwan during the Pride, during the Taipei Pride, and also the Yoga Asia conference. Yeah, and we speak together and came out together collectively, before the 80,000 people. This is the remarkable time for us. And finally, we have more people from Asia that can join the global intersex movement. So now you can see Jeb from Philippines, Ethan, Ethan from Nepal. Yeah, Ethan is also our speaker today, and Ethan is our chair now. Yeah, and Gopi from India. These are, our pioneer activists in the Asia region. And finally, in 2018, we get together to have our first Asia Intersex Forum. And we decided to build Intersex Asia as a network to incubate and mobilize our movement in Asia. And we also launched the first public statement, Asia Intersex Statement, as the movement guide. Yeah, I think so. I don't have much time, right?
Yes,
So,
Haika.
okay. So the rest of the part is about Intersex Asia. I think we can have other, if we have other opportunity, we can talk about more. Yes.
Okay, thanks, Haika. Sorry, I jumped in because you already taken extra 10 minutes without knowing.
Okay. Oh my God.
Yeah,
I'm
yeah, actually. So
yeah,
maybe
but
we can, yeah, go ahead.
maybe have a last slide.
Sure,
This
if you
one.
want to. Quickly, half
Yeah.
minute. Just 30-second,
Okay.
Haika. Yeah.
Okay. Our movement and our demand is simple. First is to end discrimination and against intersex people, to ensure the right of body integrity, to ensure the right of physical autonomy, to ensure the right of self-determination. And there are more that we demand, please, go to our website to check it. We have, translated our statement into 15 different languages, the first one. Yeah, and welcome to, stay in contact with us. We are ready to work with you. Thank you for your support.
Thanks, Haika, for this wonderful presentation. Of course, as said by Haika, if you have any comments or questions, you can put in the Dropbox. And also, if you want more information about Intersex Asia, feel free to actually look into our website because there are a lot of information about Intersex 101 and other knowledge materials as well. And also, if you want to receive newsletter or any information about Intersex, feel free to subscribe to our newsletter. Haika, again, thank you so much. I personally liked your presentation. I think, of course, the participant also did like it. I think I can say that, especially on the intersex definition, variation, and challenges, and of course IgM, intersex gender mutilation, because is one of the very talkable topic now. We need to really focus on that as well. I like what you said about, I exist, because that's a very good phrase. We need to keep doing that in regional level and also at the global level as well, and of course at the country level. Thanks for highlighting that intersex is biological, not gender, and also intersex is not hijra or transgender. Anyway, we have, the speaker and activist Sylvie from India, who is really going to talk about the distinction between intersex and transgender. Without wasting any time, I would like to invite Sylvie again to show us a short video, I think, right, Sylvie? That will give us a bit overview about intersex and transgender difference. Over to you, Sylvie.
Thank you, Selvin. As I said, we will go ahead with the video part. Let me just share the screen and put it here. Can you see it? Can everyone see my screen?
Yes.
Okay. Yes. Can you hear it?
What is the difference between transgender and intersex? If you're curious about the terms transgender and intersex and how they differ, you're in the right place. Let's break it down in a way that's easy to understand. First, let's talk about what it means to be transgender.
Sylvie, you want to make it full screen because right now it's not in the presentation mode. Yeah.
For example, a person assigned male at birth might identify as a woman, or someone assigned female at birth might identify as a man. Some people might not identify strictly as male or female and could be non-binary or genderqueer. Now, let's move on to what it means to be intersex. Intersex people are born with physical sex characteristics that don't fit typical definitions of male or female. This can include variations in chromosomes, genitalia, reproductive anatomy, or hormones. For instance, an intersex person might have female chromosomes, but genitals that appear more male, or vice versa. These variations are natural and can be visible at birth, during puberty, or later in life. A key difference between the two is that being transgender is about a person's internal sense of their gender, which may not match their assigned sex. On the other hand, being intersex is about the physical characteristics of a person's body that don't fit into the typical male or female categories. To clarify further, a transgender person typically has a body that conforms to a binary understanding of male or female anatomy at birth, but their gender identity is different from their assigned sex. In contrast, an intersex person's body itself does not fit neatly into these binary categories due to variations in their sexual or reproductive anatomy. Another important point is that intersex and transgender are not interchangeable terms. While a person can be both intersex and transgender, these identities are distinct. An intersex person may identify with any gender, just like anyone else, and may or may not identify as transgender. Similarly, a transgender person may or may not be intersex. In terms of how these individuals live their lives, transgender people may seek medical treatments like hormone therapy or surgery to align their bodies with their gender identity. Intersex people, however, are often subjected to medically unnecessary surgeries in infancy to make their bodies conform to typical male or female standards, which can be harmful and is a topic of significant debate and advocacy. Understanding these differences is crucial for respecting and supporting both transgender and intersex individuals. Each group faces unique challenges and needs, and recognizing these distinctions helps in providing appropriate care and advocacy.
Yes. So I just want to only, sorry, am I, sorry. Just wanted to add a very South Asian perspective to this. I'll just take a minute. Basically, the most visible people, I would say, especially when we talk about hijras, the hijra communities in South Asia. And when I say South Asia, it is Bangladesh, Nepal, India, and Pakistan. So in these countries, a lot of a very common misconception is that all the hijras are intersex. Actually, it is not right. In fact, for a very long part in history, intersex individuals, in a way, quote unquote, were protected under the whole guise of being hijras. But it is also very misrepresented. So in South Asia, what generally happens is that when an intersex child is born, parents generally give them to the hijra communities because they are supposed to be kind of, I would say the God-given. They are natural hijras in a way because of the whole idea of castration and the culture basically which kind of goes around. But actually that defeats the purpose, because then the misconceptions are more I would say strongly reinforced, which should not be the case. uh, Nowadays, of course, thanks to the movements, the intersex movements, that now people are kind of differentiating between the two. But unfortunately, still in South Asia, a lot of intersex children are actually given to the hijras, and then they are kind of, brought up as being hijras. So I just wanted to kind of, focus on this issue also. And yeah, I think I'm done with this. Thank you. Selvan, over to you.
Thanks, Selvi, for this wonderful video presentation. I personally liked it. By the way, I want to tell the participants, if you have any questions or any comments or any clarification you needed, please feel free to, put it in the chat box. We are happy to answer your question during the Q&A session. Selvi, I really liked the presentation, also the way you said about the South Asia context, the misconception about intersex and the trans community. I again would like to emphasize again on the behalf of Sylvie and Heike that intersex is not hijra or transgender. Sylvie, again, thank you so much for giving us the knowledge on intersex and trans community and the differences. Yeah. Now I would like to go to the next speaker who is very handsome. I think that person should show his face. Prashant Singh, who is working in Intersex Asia. So Prashant Singh is going to talk about the legal framework or legal rights status for intersex individuals in Asia. Prashant Singh is a human rights lawyer from India. He currently works with Intersex Asia as a research and advocacy officer. He has been part of national and international advocacy initiatives and efforts on intersex rights in India. Sorry, Prashant, over to you. I think you are here. Show your video and your presentation. Over to you, Prashant. Yeah, thanks.
Thanks a lot, Selvan. Am I audible?
Very much,
My
Prashant.
my screen is also visible, right? Yeah, great.
Make it a full screen.
Right. Yeah. Is it clear now? Yeah, wonderful. Thanks a lot, and thanks a lot to IPPF team also for collaborating with us on this webinar. It's You've already gotten a broad overview of what intersex issues are and how the movement actually began globally. My role here in the next 10 minutes is basically aiming to summarize the research that we have done over the past 3 years. So, like Selvan mentioned, I work at Intersex Asia as a research and advocacy officer. And my role involves basically coordinating the research projects and supporting the community in engaging with the UN mechanisms. What I'm going to talk about today is one part of my job, which was about coordinating the research projects. So, you've heard from previous speakers about the range of misconceptions and stigma that is there with regard to the intersex community. And one of the reasons why that stigma and discrimination exists is because there hasn't been a lot of literature written from a human rights perspective. There hasn't been a lot of research from a human rights perspective with regard to intersex people. And this is what we identified as a major gap. Intersex Asia has been conscious of this gap in terms of research and knowledge since the beginning, but we only managed to get resources to conduct research from 2021 onwards. So we thought that the first step towards clearing some of these misconceptions could be to come up with at least one country report for each of the countries where we are working, so that we can give an overview of what is the situation of intersex rights in those countries. So, we are a regional organization, and we try to support the community in every which way possible. In several countries, there are lots of advocacy efforts which are going on. There are lots of awareness raising, community building efforts which are going on. And we hope that these country reports would support that kind of work. Because what happens eventually is that when an intersex activist, let's say, goes on to meet a lawmaker or a policymaker, and if they don't have documents, if they don't have research backed documentation to support their claims, it becomes very hard for them to make any headway. So that was the purpose for which these documents were created. These are all available on our website, both in English as well as, one translated version of these country reports is available on our website. I would strongly suggest everyone to check that out. And of course, we will continue to talk more about, what the reports are actually saying. So in the remaining time that I have left, I would just try to share basically insights from these country reports. So you may have already seen how Heike was describing the range of issues that intersex people face. So before I get to that, I'll broadly describe how we conducted this research. So you may remember Heike mentioned the Asian Intersex Statement. Now this is the most important document for Intersex Asia as an organization and also for the intersex movement at the regional level, because it is the most comprehensive consolidation of demands of the community. What are the needs of the community? What are the challenges it faces? And what are its expectations from the various stakeholders? So in this statement, basically, there are several demands which have been listed. And the most updated version of the statement actually has categorized those demands into thematic sections. So because this is such an important document and prepared by the community, we consider this document as a base for our research framework also. So what you will see a pattern in the Asian Intersex Statement and the structure of the country reports that you will be reading. So they are all thematically structured. So the manner in which, so that was the base of our research methodology, that we will take the statement as the base, as a starting point to explore what are the challenges. And then in terms of methodology, we try to conduct this research in two stages. In most countries where, let's say, the community was organized, we tried to first start with the literature review stage, where we engaged a national level researcher who prepared a first draft of the report. And in case, let's say, in countries where the community is present, we also conducted a community consultation so as to examine whether the written first draft of the literature review was aligning with their lived experience. So that was the approach that we followed. And in most countries, the report is comprised of two sections. Basically, first one being covering the literature part of things, that, okay, analysis of the laws, policies, and also analysis from key informant interviews. And lastly, there is a community consultation report as well. So this is broadly, how we went about our research. So now these are the thematic areas which are covered in each of our reports. Now, if you'll go through the Asian Intersex Statement, you'll find all these thematic areas listed there. I mean, the foremost issue for the intersex community is violation of their right to bodily integrity because of the unnecessary medical interventions which are performed. So, of course, this is the most important thematic area for our reports. And there is a lot of analysis in each of the country reports, where you will find that, first of all, each of these reports, they lay down, okay, what is the current legal regulation on that particular topic? Are there any countries which are recognizing that these surgeries are violating right to bodily integrity? Are there countries which have thought about placing some restrictions on it? Have they thought about any kind of medical protocol to, to regulate the conduct of medical professionals? So just this way, we have tried to cover whole range of issues which intersex people face throughout their lives, and kind of categorize them into 10 thematic areas. And I'll be talking about each of these thematic areas, in my presentation. So when we talk about the first issue with regard to protection of bodily integrity, this is sadly one of the most I mean, this is one area where hardly any law or policy exists in any of the Asian countries. Here and there, you would find that there are some states in India, there are some guidelines in Taiwan. Aside from that, there is no recognition of the fact that there are these medical interventions which are performed on intersex infants and children, and there is no recognition of the harm. There is no recognition of coming up with any kind of medical protocol to regulate the conduct. A number of UN treaty bodies, number of UN mechanisms have recognized this as a human rights violation. The Committee Against Torture has even considered these medical interventions as torture, and still states have not, understood the significance of this harm and haven't created any medical regulation. While you may think that the picture is very pessimistic, but I should also note that there is some movement happening on this particular front. Starting with where I'm calling from in India, we have a state in Tamil Nadu, which in 2019, the government passed a government order which banned intersex surgeries across the state. Now, there are, of course, serious limitations because this is just an executive order. This is not a comprehensive law, and this is not what the community actually expects because an executive order will not provide the level of protection that is really needed. And even after passage of that particular government order, we haven't really seen that being implemented in the state of Tamil Nadu. Following, the success of Tamil Nadu, there was a lot of work done by intersex activists as well as allies to, push for similar policies in different states. Delhi was one example where we thought that we would really see, a ban on intersex surgeries. However, that hasn't, come to light as yet, and intersex activists are still pushing for it. The situation in India seems to give us some hope because there was a major judgment in the marriage equality petition where the Chief Justice of India, in his opinion, wrote that intersex surgeries need to be banned nationwide. Now, this could be considered as a base for building on a nationwide ban. However, the same is not really being recognized, and sadly, whatever steps that the government is taking in order to implement those directions from the Chief Justice, there is hardly any consultation with the intersex community. And I'm very concerned to note that in the month of February, I saw a press release by the Ministry of Health and Family Welfare that they have already framed guidelines with regard to this issue. However, I'm not aware of any consultation that has happened with intersex community. Now, this is something which I wanted to highlight, that when governments are even recognizing this problem, they are not recognizing this in consultation with the community. The people who are most affected by this issue, they are not being considered while framing any guidelines. If you see examples around the world, the models which exist, primarily they are in European countries, you would see that a multidisciplinary committee has been created, which also includes intersex activists, because intersex community also is not absolutely opposed to any surgery. The community recognizes that in life-threatening situations, you may need to conduct surgeries. However, that process needs to be done after careful consideration of multiple opinions. And this is the kind of mechanism we would like to see in countries where these are possibilities. However, sadly, that's not really happening. We had a little bit of that in Tamil Nadu. However, that also hasn't materialized into anything real. Aside from India, one possible success that we might see in the coming months and years is probably going to be Thailand, where Intersex Thailand, which is one of the key organizations in Asia, they are pushing for a comprehensive law with regard to protection of intersex rights, and a ban on surgeries is included in that particular draft law. The organization is currently, collecting 10,000 signatures so as to be able to submit this petition to the government. As you know, Thailand is kind of making a lot of progress broadly on LGBTQI rights. So we hope that they would also follow this commitment with regard to intersex rights. So these are two
Prashant, I'm sorry. I
examples.
think you need to wrap up.
Oh my.
Yeah.
All right. How much time do I have?
You already taken 5 extra minutes, so
Okay, I'll try and wrap up in 2 minutes. I thought I would be able to cover all 10 thematic areas. Okay, so these were two positive examples, but there are many, many concerning examples. I'm sure you'll hear soon from Maimoon how hospitals in Bangladesh are advertising that they have specialized, DSD centers. These are very concerning developments, and sadly, there is not a lot of recognition of these issues. While this is one, I would also like to just briefly mention with challenges with regard to access to healthcare. Now, what follows from this violation of bodily integrity is complete lack of recognition of healthcare needs of intersex people. One particular issue, if I may mention here, is a serious lack of access to essential medication. In countries like Philippines, there are serious challenges for people with CH variation who are not able to access seriously essential medicines. The government is also now taking recognition of this fact. Fortunately, we have Intersex Philippines there, which is trying to fill this gap. But of course, it is at the end of the day, it's a civil society organization. It cannot do the work which a government is supposed to do. But still, with the support of Intersex Asia, we are starting a small initiative, whereas in which we would like to conduct a small project where we try and provide these essential medicines to affected people. But this is just one small picture. Availability of medicines, something which is such a bare necessity, is not being fulfilled, let alone the whole need for having a comprehensive healthcare protocol. There were multiple things that we wanted to cover, and I would suggest everyone to go through our reports. But lastly, if I may just mention something which is usually goes unnoticed, is exclusion in emergency response mechanisms. So, we all have been through the pandemic. The community has been through so many natural disasters in so many Asian countries, in Nepal, floods, typhoons in Philippines. And every time, in all these instances, the government comes up with some kind of relief mechanisms, right? The government recognizes that there are vulnerable, marginalized sections which need additional support. In none of these measures, we have conducted research in 9 Asian countries where we found there was no recognition of the specific challenges faced by intersex community. Going forward, I would hope that people recognize this now, because there is documented research available about this exclusion. It was such a serious situation that the only support that most of the intersex community got was from Intersex Asia. It's not just the government which was failing to act, it was also the civil society organizations. So that just shows the lack of awareness which exists across the board, not just within governments. And I'm glad that we are able to partner with IPPF here, which has a huge network with broad range of stakeholders. And we hope that these kind of webinars will help us spread the message about the kind of issues that the community faces, and we are able to build that kind of pressure with the governments to finally take some action. I guess I've totally run out of time. Hopefully we can handle a few questions during the Q&A section. Thanks a lot. I'll stop here.
Thanks, Prashant. Actually, you have taken some extra minute. I really have to apologize to the community speaker who's next, but really a wonderful presentation. Of course, we will share this presentation to the participants. If they have any questions or comment, of course, they can get back to us. We can also share the email ID of the speakers. Maybe they can personally get in touch with them. I really like the presentation of yours, Prashant, and thanks for doing the research, being part of Intersex Asia. Again, emphasizing we have done research. We have reports for 12 countries, as Prashant said. Remember, advocacy is not effective. It's not going to be meaningful without any stats and data. And that's the reason we have done this research and we have the data. So intersex community members can use this, when they're doing effective advocacy with the stakeholders at the country level. If at all, if you want to have some more information about this research report, please get into our website. There are research reports. You can have a clear look into that, thematically, and everything is covered. Of course, you need some time to read because it's a very comprehensive report. And also, we have this intersexation statement, which has the demands and the needs of the intersex communities. And also, I think there are some challenges. If you have some time, please feel free to, again, visit our website and look into these documents. It's available. Now I'm going to actually invite our community speaker. They have really vast experience, working for Intersex in their own country. They have faced many challenges, issues, and also they have worked for their own organization. They are taking these intersex movements forward in their country, and they have a lot of experience and advocacy as well. Here they are going to talk about their personal narratives, especially sharing their stories, their challenges, issues, and we have community speaker from 3 different countries. One is from India, Bangladesh, and Nepal. So here, firstly, I'm going to invite Momo. His name is Mohammed. Momo is not what we eat. Momo is Momo, a short name and sweet name. Mohammed. They go with they, them pronounce. Is an intersex rights advocate and community organizer focusing on queerness, bodily autonomy, and collective care. They co-founded Intersex Human Rights India, which is IHRI in short, to promote intersex justice, and founded beyond monogamy to create inclusive spaces for queer individuals. Their work emphasizes joys, transformative justice, and amplifying marginalized voices. Momo, over to you.
Thank you, Selvan. Thank you, IPPF and Intersex Asia for this beautiful platform today. And good morning, good evening, good afternoon, everyone. I know that there is a time frame. I'm gonna stick to that. I'm just gonna go with things that are more relevant to my experience of working around. And I'm so grateful that you all could join in today and hear us out. So the three topics that I thought that are very essential with the anti-gender movement rising in our context and the current funding scenarios as well, is to look at medical pathologization. The word itself is such a mouthful. From an intersex narrative lens. And the most commonly aspect of medical pathologization that a lot of intersex people hear, and we kind of amplify on the idea is that we are not a condition to fix. And let's be very vocal on this. Many intersex people around us within our community face or experience unconsented medical interventions, either in their infancy or in their childhood, to normalize on their bodies. What happens is that these surgeries are labeled as corrective surgeries or surgeries that you require to fix your body to fit into the binary, but they are more importantly most likely non-consensual. Bigger picture here, they're irreversible, which means that if they leave damage and harm on your body, that's not correctable. And sometimes, in many cases, in case of children and other ages, it is medically unnecessary. So it's been accepted by doctors themselves and people who are in the positions of power and ethics. They say that it's medically unnecessary, but for societal fitting, they have to do that because in South Asia, the bigger question is that what will people say or what will the society say? So pathologization turns intersex variations into a medical emergency, which means that despite no health risk it robs intersex people of bodily autonomy and informed decision making. I remember when I was shown to a doctor for evaluation. I remember that I quoted this to myself is that they treated my body, but they ignored my voice. So there is a lot of power imbalance in medical care, which means that doctors often speak for intersex people, treating parents or spouses or legal guardians as decision makers and erasing intersex children or adults right to their identities or right to grow within their identities and understand their bodies first. Many intersex adults around us or children also report a lot of medical trauma that comes from invasive procedures, repeated examinations, a dismissive attitude from healthcare providers. Now, an important part here I would like to say is that repeated examinations with consent is okay, but sometimes it leaves a lot of trauma, especially with unconsented doctors' touches and a stark reality into what happens behind an examination room is an unconsented touch that leaves not just scarred but just memories of uh, trauma even beyond the medical examination room. You might feel triggered just by an unconsented touch by anybody else who's not even a doctor. So what happens is that here this is not about the procedure, rather it's about the lack of consent, the lack of transparency, and the lack of and the dehumanization that our bodies face. So intersex people in SRHJ is our HRJ systems or sexual reproductive health rights systems and justice systems. We are still invisible. We are rarely included in national and global SRHR strategies. But when we are, it is under reductive LGBTI umbrellas with our nuances and actual services which are tailored to our needs. For example, in certain SRHR services, reproductive health counseling is often considered as a binary, and it assumes that infertility or fertility is gendered. So it kind of excludes intersex realities. And there's a good conversation in the chat box happening right now for menopause right now, and that reminded me that actually we do not have standardized care that exists for intersex adults who may need hormonal care, trauma-informed gynecological services, or surgical aftercare after childhood procedures. Very important research gap that we are seeing that is trending. I remember from my personal experiences that they asked about my chromosomes, but they did not ask about my experience, which means that we are missing the human behind the diagnosis. So there is this obsession of fixing the sexual characteristics, which often erases the lived experience of being intersex. The shame is installed by doctors, society, and the confusion is caused by the silence that perpetuates from us. So pathologization focuses on biology and not dignity. It teaches people or intersex people that their worth lies in being legible to the society, not being whole or not being self-aware. I would like to quickly touch upon an aspect that I feel is very important, which is what often our research organizations, health organizations, and allies who are sitting who are in with us in this webinar are often missing out on intersex experiences. We know that the LGBTQIA plus inclusion is getting a lot of attention. It's Pride Month, but at the same time, we have to recognize anti-gender movements are rising alongside. So it's really going hand in hand. So intersex specific realities are still deeply underrepresented, unfortunately. In most SRHR frameworks, this is so medical violence is often framed as care. So most health organization or SRHR organizations actually do not take a stand on non-consensual surgeries on intersex children. They're often framed as medical corrections rather than violations on bodily autonomy. So the intersex community has for long demanded a moratorium on medically unnecessary surgeries, but this reality has not been accepted by most SRHR spaces, at least publicly. So they silence us through language, the use of terms like DSD, disorders of sex development, reinforcing a very pathologizing view of intersex bodies. And intersex bodies are and people are often excluded from LGBTQIA categories and often treated as medical issue rather than a community with a political and social rights. So it's very common in the queer community. We have seen this kind of exclusion as well. I would like to say emphasize a little bit on policy and data invisibility as well. Some health organizations around us they collect experiences or collect people as data points or disaggregate data on intersex people, making them actually statistically invisible. Okay, I've got a message from Selvin saying that to wrap up, I just want to mention two more points here. Is that
Go for
lived
it, Momo.
realities
Yeah.
realities matter. So lived experiences are evidence. Let's count on them. So intersex folks and their narratives should be central for shaping healthcare policies, which means that these stories carry the truth of what is lost when it is coercive, when consent is not given, and when bodies are silenced. Many intersex people grow up with the idea after being given these medically unnecessary surgeries is that they didn't get to know their body before it was changed. So this is a common realization that a lot of intersex people sort of feel when they are denied informed consent and understanding about their own autonomy. And lastly, to say narratives are not just about harm; they are also about resilience. So when we share personal stories, it's not about just naming our pain, but it is also reclaiming our identity, demanding rights, and building pride in our intersex existence. Thank you.
Thanks, Momo. I really like the presentation of yours, and also I'm going to steal your two sentences. One is pathologization focuses on biology, not dignity. I'm going to use it later in some of my presentation, maybe in some webinar or some event. And of course, the lived experience does matter. Thanks for saying that. Now I would like to invite Ethan. Ethan is from Nepal. Ethan Redmi is the full name, is the first openly intersex human rights activist in Nepal, the executive director of Campaign for Change, who had proposed CRC and pseudo reports, condemns intersex infanticide and gender mutilation on 2016 and 2018. Ethan is also the chair of Intersex Asia. Ethan, you can share your experience. Thank you.
Thank you, Selvan. Thank you, Intersex Asia and IPPF for this platform. I can already mention that we have started our movement from the scratch. We mostly started our movement from our personal experiences. like being belong to very remote area. There is no education on LGBTI, even in sex and gender, and I faced multiple forms of discrimination, stigma, even in violence. That's why I decided to leave that my birthplace, and I came to the city. I knew about the LGBT organization. I joined the LGBT movement in 2011, and when I joined the movement in 2011, I started to learn about the intersex. And then I realized that the LGBT movement, there are so many other movement like human rights movement, movement on child rights, Dalit rights, women's and girls' rights, and LGBT rights. And none of the movement include the intersex issues, and they none of them discuss on intersex issues in their work. And LGBT movement included I in their acronym, but it has been overshadowed for a long time. And mostly people who have the intersex variation, but they don't comfortable with don't comfortable with term LGBT, they really feel excluded from the human rights discourse. And that's why we started our discussion with the intersex individual since 2011. Then we formed the kind of a group, and we organized the intersex first intersex national gathering in Nepal in 2016 with the support of UNDP Bangkok office. And since then, we have been very much focused on specifically on intersex human rights. And after this first gathering, we have submitted our shadow report to the CRC committee to to talk about the intersex genital mutilations, infanticide. This is the global issues of intersex people, and it's also happening in Nepal. There are so many hospitals. The surgery has been ongoing. There is no consent from the intersex individual. Most of the surgery are not necessary for their body. That's why they have been facing multiple forms of violence from the family, society, and even from the state. We have been able to raise our issues not only in the CRC, we also raise our issues in the different mechanism of UN human rights. And those committee made the concluding observation to the Nepal government, but Nepal government failed to implement it, because the Nepal government used the term LGBT, like sexual and gender minorities, for the LGBTI. Sometimes that broader LGBTI approach overshadow the specific concerns of intersex individual. And even though we continue our advocacy for the social behavioral change regarding on intersex and policy inclusion, and awareness raising with a larger audience, and we are able to include intersex issues in some policy, like policy in national child rights policy, and the policy document is child protection and child rights directives, and also some of the like program and planning, annual program and planning of the different layer of the government. Like we have the local level government, provincial level government, and the federal level of government. We advocate with those government entity to include the intersex issues for their program and planning, because until and unless the government like take ownership on intersex issues, there is no recognition from the other civil society organizations and even from the government as well. However, in Nepal, many intersex people face rejection from the parents because of societal discriminations. We have been doing various kind of awareness raising program, even though many intersex individuals have been facing rejection abandoned from their family, because family have the fear because of the societal pressure and the and the societal stigma and discriminations. And most of the time parent hide their child's intersex identity because of the societal discriminations, mean lack of support. And intersex infants and children are often subjected to irreversible and non-consensual unnecessary medical surgery to fit their body into the binary sex norm in early age. That's why those children who the surgery are not necessary, they have been facing serious health issues, not only physical health, mental health issues as well. There are even though there are some progress, we have the inclusive constitutions, and there are some positive step towards intersex inclusion in the policy, but there is no legal protection to prohibit the harmful medical intervention on intersex children, and free from their physical and mental torture to ensure their bodily integrity. And most of the time parents are pressured to into making decision without full information or support for their children, while intersex individual grow up without knowledge of what was done with them, because none of the parents, they don't want to share the full information. Sometimes even medical professional don't share the full information on intersex children to their parents. Intersex people are forced into the other gender categories. That's why many of the intersex individual denial to access obtain their legal documents with their identity, because there is no legal recognition for the intersex individual. There are many discussions regarding on legal gender recognition. Sometimes these umbrella from approach also forced to intersex individual for their unwanted decision making for the gender. Many intersex children are denied from the birth certificate. In Nepal, birth certificate is very crucial document, and many intersex children are denied. Sometimes intersex children are given the derogatory word like napungsak. Some of the children, they are given the birth certificate term with napungsak, that create the long-term barrier to get education, healthcare, and even other legal document, because without
Ethan,
birth
I'm so
certificate.
sorry. I'm so
Oh
sorry.
my
You
god.
need to wrap up. I'm really sorry. I apologize
Mm.
for this,
Yeah.
but yeah, please wrap up. Yeah.
Yeah, sorry, because we have so many things to share, but I would like to touch upon the HRHR in 1 minute. We also have so many other issues like HRHR. We never talk about the intersex HRHR issues, and none of our program policy regarding the HRHR inclusive for the intersex individual, because still Momo already shared that always fertility considered for the binary sex, but intersex individual have the fertility and they are able to produce the child, right? None of the maternal health have the inclusive for the intersex populations who are able to give the birth. And intersex individual menstruate and they require access to product and the respective care, but menstruating intersex people often face stigma and confusion from the both fear and the service provider, because none of the menstrual hygiene and the menstrual health and hygiene programs do not include the intersex population, and those services are not inclusive for the intersex individual. We have to discuss these things within our HRHR issues, and many intersex individual need the contraception for various reasons, including the manage their reproductive health, so many things, right? But always contraception only focus for the binary sex, now for the trans population as well, but none of the time it's considered for the intersex individual. So we have so many issues like legal and even SR issues. We have to discuss it in detail with the like-minded organization to raise our issues from the intersectional approach. I'll stop here. So it's very short time. I couldn't cover all the things. Anyway, thank you so much.
Thanks, Isan. I was quite hesitant to, ask Isan to wrap up because he is the chair of Intersex Asia. Hope I don't face any consequences after this. Isan, thanks anyway for this wonderful presentation and speech. Let's invite Maimoon. Maimoon is from Bangladesh. She is a very young activist, the same age as me. Maimoon, don't get offended. I'm just kidding. So Maimoon is dedicated intersex human rights activist and the co-founder of Intersex Bangladesh, with a background in community organizing, advocacy, and legal rights education. He works to amplify intersex voices in Bangladesh and across Asia through grassroots activism, policy engagement, and regional collaboration. Maimoon, before handing over the mic, I request you to just keep it within the time. You have 5 minutes, please. Just go for it. Yeah, thanks.
Yes. Thank you. Hello, everyone. Thank you, Intersex Asia and IPPA for this opportunity. So my name is Maimoon. I'm from Bangladesh. I'm co-founder of Intersex Bangladesh. So we are working for intersex human rights and community support and livelihood support. So as intersex person in Bangladesh, so we are facing different discrimination, stigma, and legal issues, medical issues, and social issues. So for me, I was born in a small island, so where people are not educated, and people don't know what is intersex, and people not ever. So after my birth, people told that this is a hijra. This is hijra child, and they were very interested to see my genital, and they always like disturb my family that to see my genital. This is how, and they counted me as hijra, and my family was also confused about me, and then they rise up me as a girl. They gave me a name, female name. So then after my 12 to 13 years old, when I saw I have some changes in my bodies, like my voice and my expression changed like a boy. So then I talked with my parents, but they told me that don't share with anybody. People think that you are hijra, but if hijra people know about you, then they will take you. So this kind of things, and I noticed that from my childhood I was isolated, and they always thought that the hijra community will take me, and that's why they were uh, so furious about this situation. So this is how, and after that, like then from 2017, we started we started our journey as like born in this body. So after that, me and our some of intersex community, intersex friends, we started a online platform, which is now Intersex Bangladesh. So our problem is in Bangladesh, we are facing so many challenge. For example, we are facing stigma and discrimination from birth to death, and after birth, and people say that this is hijra, and religiously we are count as a devil child, and socially, and we have to change our school frequently, and most of the intersex community are excluded from education, and some of we are trying to continue our education with various very like um, struggle. So even though family doesn't want their children to be educated, and so and also this kind of challenge this kind of challenge we are facing. And also we have big issues that after born as intersex child, so family, if their family go to doctor and the doctor suggests them to surgery, because in Bangladesh we have recently before 3 years the government started a d- a outdoor clinic, which is DSD clinic, and then go and they are announced that if people interested to surgery their children, and they can come, and this is free, and their intersex child will be fixed male or female. But in really this is not actually happening. This is like they are that children after surgery, that children facing different problem and physical challenges. So this is happening, and like yeah, this is happening in Bangladesh. So, and also for protecting, so we are trying to make awareness about that surgery, what is actually happening to their parents. But this is a challenging. Still, we are trying. We will try, but this is challenging. That recently we have the experience that in a hospital, where like intersex surgeries happening. So we when we made those parents, and we were talking about the surgery issues, that time the parents talk like they got angry, and they called to security guard that, and they told that there is a hijra, there is some people coming from hijra, and they will take my our children, and this is happening, and they believe that their children are hijra, and they if they disclose this identity, then the hijra community will take them, and this is happening. But we are trying to convince them, and they need and also we have an intersex network, and who are recognize them as intersex person and who know themselves. So but they are actually they are facing different challenges, and they need help. We are trying with the help of Intersex Asia, we are trying to help them. And then but they are facing different issues, and even they have to change their location frequently because of the society. If their society know their identity, physical identity, then they count them as Hijra, and they people treated them in different ways, like devil child, and different problem we are hearing from them. And yeah, this is how it's happening, and we are trying, and Intersex Asia is helping us, and yeah, in future we will do.
Thanks, Memoon, for giving us context about intersex issues in Bangladesh. Let us open this floor for Q&A. Maybe we can take only 2 questions because of time constraints. If anyone would like to ask questions or any comment, please open your mic and please speak up. Please keep your question very clear, not like in an elaborative way, very short and clear. Thanks. Um, Anyone has any question? Or else you can put it in the chat box also. We have the speaker to answer. If not, then meanwhile, I can ask the question which was dropped in the Dropbox about the menopause. I think Momo already covered a bit about this question. Maybe Ethan can talk about this, about the menopause. Ethan, what do you think about the research? And is there any report available on intersex people on the menopause in Nepal? Ethan?
Yeah, we have conducted some research. We can share if you want, if anyone want to learn more from the our research report. The research are on like intersex human rights violence and legislation gap analysis, and there are the few research report, and we are also like conducting research on coming out as intersex and livelihood. There are so many things we have to build the knowledge to educate the people on intersex and raise the awareness to protect the human rights of intersex people.
Thanks, Jason, for this. Any more question? If not, I can raise one question to our Bangladesh speaker. Memoon, I'm putting you on the spotlight. Just want to understand from you. Yeah, sure, Haika. You were saying something?
Yeah, I think Ethan might miss to hear the menopause, right? I believe the menopause experience, this kind of research, intersex, about intersex, maybe never happen because, as you see, we face the erasure from the beginning of our life. So we were like assigned to either male or female, in a very short time after we were born. So it's hard, it's obviously it's hard to find menopause research specific on intersex. And also in the statistic, I think there's no official statistic, that is intersex included. That's why it makes it difficult. That's why we need to make intersex people visible. Because we are not visible, you cannot see anything about us. That's why we don't have so many research on intersex people, especially focusing on our experience. Yeah. And maybe I'm not sure that if Prashant have any opinion about this because it's about research. Yeah, maybe Prashant can give input as well.
Very briefly, if I can mention that the only available literature in medical journals that I increasingly see is medical professionals trying to justify their approach, trying to justify the necessity for medical interventions. There is no intention to understand, the serious healthcare issues that intersex people face. Very often, whatever limited, material that I've seen in even published in medical journals is usually about them conducting kind of surveys, or let's say conducting some research to justify their approach that, okay, surgeries are necessary, medical interventions are necessary. It's, of course, a very clear violation of ethics from bioethics perspective, from medical ethics perspective, from every ethical standard. So yeah, I mean, sadly, there is not much, and this is exactly the kind of research that is very much needed to be conducted, actually, ideally in collaboration with healthcare professionals. But yeah, I guess there is a long way to go before we build that kind of a collaboration, because there are hardly many allies within the healthcare sector. So sadly, no good news here. Yeah, hopefully in the future we'll see
Thanks,
something.
Vishant. Thanks, Haika. Sorry, we are running a bit over time. Apologies. And thanks, participants, for your patience. And also, I would like to thank everyone for giving me an opportunity to moderate, especially to IPPF and Intersex Asia. Thank you. I hand over the mic to Haika first for the closing remarks, followed by Sylvie to officially close this webinar. Over to you, Haika, and then you hand over the mic to Sylvie. Thank you.
Okay, as we conclude today's webinar, again, I would like to extend my sincere gratitude to IPPF for collaborating with us on this significant initiative. Also, I want to extend my heartfelt thanks. Thank you to all our speakers for sharing their expertise, knowledge, and experience. And of course, our participants as well, for your active engagement and commitment to learning. Last but not the least, thanks to our Intersex Asia and IPPF staff for their coordination and efforts in organizing this webinar. Today, we have gained a deeper understanding of intersex variation, moving beyond societal stereotypes. We have heard personal narratives that powerfully illustrate the challenges faced by intersex individuals and the gaps in SRHR services. We have also explored the legal rights status for intersex individuals in Asia and a strategy for improving policy and public awareness. The journey towards field recognition and respect for intersex rights is ongoing, but your presence here today is vital step forward. We hope you leave this webinar with practical insights and a renewed commitment to developing meaningful advocacy plans within your respective fields or communities with intersex movement. Intersex Asia is ready to work with you together. On behalf of Intersex Asia and IPPF, thank you once again for being part of this crucial conversation. We look forward to continuing to work together to build a more inclusive and understanding world for intersex individuals. Yeah. Over to you, Selvan.
I can go.
Maybe, yes, sure, Sylvie.
Thank you. So first of all, thanks a lot. Thanks Intersex Asia to agree to be a part of this webinar hosted by IPPF, actually co-hosted by IPPF, and Haika from Intersex Asia, Harjot also from IPPF to facilitate the whole process, Selvan for moderating this webinar, and many thanks to Madhurima, Purnima, and Andre for support with communications for this webinar. Prashant from Intersex Asia, a big thanks to you. Momo from IHRI, India, and Maimun from Intersex Bangladesh, and Isan from Campaign for Change, Nepal. And last but not the least, thanks to all the participants for joining this webinar. Thank you so much. And I'm very sure that this is just the beginning. There will be more collaborations that we can kind of do in the future. Thank you so much.